Prednisolone Sodium Phos Odt is a medication used to treat a variety of conditions such as arthritis, blood disorders, severe allergic reactions, certain cancers, eye conditions, skin/kidney/intestinal/lung diseases, and immune system disorders. It works by decreasing your immune system's response to reduce symptoms like swelling, pain, and allergic-type reactions. This medication is classified as a corticosteroid hormone and may also be used with other medications in hormone disorders. It's important to follow your doctor's instructions and take the prescribed dosage at the recommended time for the best results. When taking Prednisolone Sodium Phos Odt, make sure to take it with food to avoid upsetting your stomach. The medication is meant to be dissolved in the mouth, on top of the tongue. Remember not to remove the tablet from the blister pack until you are ready to take it. With dry hands, carefully peel back the foil on the blister pack to remove the tablet. Place the dose on your tongue and let it dissolve completely before swallowing with saliva or water. Do not crush, split, or break the tablet before taking it. It's important to follow your dosing instructions carefully, as the dosage and length of treatment are based on your medical condition and response to treatment. Different dosing schedules exist for prednisolone, so be sure to mark your calendar with a reminder if you are not taking the same dose each day or if you are taking it every other day. Consult your doctor or pharmacist if you have any questions. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when the drug is suddenly stopped. Your dose may need to be gradually decreased to prevent withdrawal symptoms such as weakness, weight loss, nausea, and muscle pain. If you have used prednisolone for a long time or in high doses, you are more likely to experience withdrawal symptoms. Make sure to tell your doctor or pharmacist right away if you have any withdrawal symptoms. And if your condition does not improve or worsens, be sure to inform your doctor. Side effects of Prednisolone Sodium Phos Odt may include nausea, vomiting, heartburn, headache, dizziness, trouble sleeping, appetite changes, increased sweating, or acne. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember, this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. This medication may make your blood sugar rise, which can cause or worsen diabetes. Tell your doctor right away if you have symptoms of high blood sugar such as increased thirst/urination. If you already have diabetes, check your blood sugar regularly as directed and share the results with your doctor. Your doctor may need to adjust your diabetes medication, exercise program, or diet. It may also lower your ability to fight infections, making you more likely to get a serious infection or make any infection you have worse. Tell your doctor right away if you have any signs of infection such as a sore throat that doesn't go away, fever, chills, cough, or white patches in the mouth. If you experience any serious side effects such as unusual weight gain, menstrual period changes, bone/joint pain, easy bruising/bleeding, mental/mood changes, muscle weakness/pain, vision problems, or symptoms of stomach/intestinal bleeding, contact your doctor immediately. In the U.S., call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. Before taking this medication, it's important to let your doctor or pharmacist know if you have any allergies to prednisolone or prednisone, or any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to talk to your pharmacist for more details. Before using prednisolone, make sure to inform your doctor or pharmacist about your medical history, especially if you have any of the following conditions: bleeding problems, blood clots, brittle bones, diabetes, eye diseases, heart problems, high blood pressure, infections, kidney disease, liver disease, mental/mood conditions, stomach/intestinal problems, or seizures. The use of prednisolone may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving or using machinery until you are sure you can do so safely. Additionally, daily use of alcohol while taking this medication may increase your risk for stomach bleeding, so it's best to limit alcoholic beverages. Prednisolone can make you more susceptible to infections or worsen current infections, so it's important to stay away from individuals who have contagious infections such as chickenpox, COVID-19, measles, or the flu. It's also crucial to inform your healthcare professional before receiving any immunizations, vaccinations, or skin tests, and to avoid contact with people who have recently received live vaccines. Long-term use of corticosteroid medications like prednisolone can make it more difficult for your body to respond to physical stress, so it's important to inform your doctor before any surgery, emergency treatment, or if you experience a serious illness or injury. It's also recommended to carry a warning card or medical ID bracelet if you will be using this medication for an extended period of time. Older adults may be more sensitive to the side effects of this drug, especially bone loss/pain, stomach/intestinal bleeding, and mental/mood changes. For children using this medication for a long time, it may slow down their growth, so it's important to consult the doctor regularly to monitor their height and growth. During pregnancy, this medication should only be used when clearly needed, as it may rarely harm an unborn baby. It's important to discuss the risks and benefits with your doctor. If you are breastfeeding, it's unlikely that this drug will harm a nursing infant, but it's crucial to consult your doctor before doing so. Drug interactions can change how prednisolone sodium phos Odt works or increase the risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with prednisolone sodium phos Odt include aldesleukin, mifepristone, and other drugs that can cause bleeding/bruising. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking it unless your doctor instructs you otherwise. Other medications can affect the removal of prednisolone from your body, which may affect how it works. This medication may also interfere with certain lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone has taken too much prednisolone sodium phos Odt and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important to never share this medication with others. If you're using this medication for a long period of time, your doctor may want to perform lab and/or medical tests such as blood sugar/mineral levels, blood pressure, eye exams, bone density tests, and height/weight measurements. Make sure to keep all of your medical and lab appointments and consult your doctor for more details. To reduce the risk of bone loss, osteoporosis, during long-term treatment, consider making lifestyle changes such as increasing weight-bearing exercise, quitting smoking, ensuring you get enough calcium and vitamin D, and limiting alcohol. For specific advice, consult your doctor. If you happen to miss a dose of prednisolone sodium phos Odt, take it as soon as you remember. However, if it's almost time for your next dose, then it's best to just skip the missed dose and take your next dose at the regular time. Avoid doubling the dose to make up for the missed one. If you don't take the same dose every day or if you take this medication every other day, it's important to consult your doctor or pharmacist about what to do if you miss a dose. It's important to store prednisolone sodium phos Odt at room temperature, away from light and moisture. Avoid storing it in the bathroom, and be sure to keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. If you have any questions about how to dispose of prednisolone sodium phos Odt, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.